The scary thing about heart disease is that oftentimes a person doesn't know he or she has it until a cardiac event happens. But there are things you can do to prevent it. All you have to know is your ABCs.
The following segment is sponsored by Geisinger Holy Spirit.
So often cardiac problems come out of nowhere.
The scary thing is 90% of sudden cardiac deaths that occur in men. Even scarier, 50% of these have no preceding symptoms.
Which is why cardiologist Dr. Aditya Sharma says knowing the risk factors and working to prevent heart disease altogether is your best option.
It's important to understand that coronary artery disease is progressive, so it continues to it keeps on going. And so what we do actually is to halt it or slow down the progression of it.
Preventing heart disease means knowing your ABCs.
Aspirin to be taken for those patients that need it as a preventative measure, blood pressure control, cholesterol management, and then stop smoking or do not smoke at all.
Dr. Sharma says men are more likely to get heart disease than women, and that's most likely because of hormones. Usually men are affected after they turn 60, but it can happen earlier if there's a history of heart disease in the family. The good thing is, he says, if you take action to control your risk factors through diet and exercise, there are more than just heart benefits.
Not only affects the heart, it affects the brain, your other organs as well. And so people generally say they feel much better.
Dr. Sharma says men should see their doctors for annual checkups. Oftentimes, he says, they don't, and those visits are crucial, especially as they get older. With this week's Doc Talk, I'm Lara Greenberg, CBS 21 News.